As we study the numbers on the coronavirus cases and the deaths related to COVID-19, a similar question comes up again and again. Why is the coronavirus causing so many more deaths in Italy than in other countries? This question relates both to the absolute number of deaths, which was exceeded only in China before, and to the case fatality rate, which has risen to 44% and exceeds any other country in the world. To make sure we are all on the same page, the case fatality rate of COVID-19 is the number of confirmed deaths due to COVID-19 divided by the total number of confirmed cases of infections with the coronavirus SARS-CoV-2. The case fatality rate (CFR) should not be confused with the mortality rate or death rate, while it often is confused with them, which is simply the total number of deaths that occur during a specific time frame divided by the number of the total population at approximately the same time. Currently, we are more interested in the CFR because we see the number of cases growing and we want to know how many of these diagnosed cases will result in the death of the patients. The CFR is currently at 0.090 or 9.0% in Italy, 2.1% in France, 0.8% in South Korea, and 0.2% in Germany, according to the latest data collected by Worldometer. What explains these immense differences? The cases behind the case fatality rate let us assume every country is equally capable of counting the numerator of the CFR, the fatalities due to COVID-19, and will report them accurately, an assumption that is tolerable if we focus on non-authoritarian high-income countries. What do we then need to know about the denominator, the confirmed cases? The strongest predictors of fatality due to COVID-19 are age and pre-existing conditions of the infected. The number of pre-existing conditions is positively correlated with age, so let us for simplicity only look at the age of the confirmed cases. Clearly, because age is so predictive of death by COVID-19, comparing the case fatality rates across countries only makes sense if the underlying cases of coronavirus have approximately the same age across countries. What do we know about the age of the people that have been found to be infected with the coronavirus? This information is not easy to find, but it has been popping up in reports and newspapers from the various countries over the past days. The diagrams and figures reported in the following are based on statistics reported by the Korean news agency News One Screenshot and the Italian daily newspaper Corriere della Sera. Grouping the age in 10-year intervals and comparing the percentage shares of cases that fall into each age group reveals a striking dissimilarity between South Korea (red bars) and Italy (green bars). Recently, 3% of all confirmed cases in South Korea were at least 80 years old. At about the same time, 19.1% of all confirmed cases in Italy were at least 80 years old. This enormous difference occurred. The absolute numbers of confirmed cases overall were similar in the two countries, 8,036 in Italy versus 7,134 in South Korea. Consequently, Italy's healthcare and hospital system had to take care of a much higher number of infected older patients than the South Korean one, patients that need more intensive care and that are simultaneously more likely to pass away. A clear implication is that the Italian CFR is not comparable to the Korean CFR. The people infected with the coronavirus that the Italian CFR are much older than those that enter the Korean CFR, and as older people are much more likely to die of COVID-19, they push the Italian CFR upwards. Another implication is that explaining the different CFRs with differences in the healthcare and hospital systems between Italy and South Korea might be premature. In the current coronavirus crisis, South Korea's hospitals and intensive care units have never been tested to the extent that Italy's currently are. Which CFR is unusual, Italy's or South Korea's? An obvious question that follows is, why do these age distributions look so different in the two countries? Many people have already pointed out that Italy has an older population than South Korea. The higher Italian CFR might therefore reflect a higher likelihood that an old person becomes infected with the coronavirus simply because